can honestly tell you that I am passionate about my work, and if I wasn't passionate, I'm old enough to have retired by now. I was a general obstetrician gynaecologist with an oncology team at the Royal Marsden. While I was there, I came across so many young women who had a very sad diagnosis of cancer. All of them, without exception, actually were almost as severely hit by the idea that they might not be able to have children because of the treatment they were about to have. So then went off to spend some time with Professor Kraft doing fertility work and decided that that's where I actually wanted to be. I went to Italy for nearly 20 years where I was running my own clinics in Italy, then came back to the UK and have been working in London in the private sector most of the time. And this is the best place ever, Avenues. It's a place which welcomes independent doctors and satellite doctors. The nursing team's fantastic, the hospitality team's fantastic, and everyone's in sort of can-do mode all of the time. And the lab is superb, and we've got the most incredible research going on. I don't think I've ever seen such good quality embryos in a lab for a long time, and that's partly down to the AI selection. The patients love it, especially the part about observing their own embryos developing in the lab. They can have access to 24-hour time-lapse video and watch their embryos develop, and having information and input from the embryologists. I think people mainly come to me because they know someone who's been to me. So it's often word of mouth, and that happens to a lot of people. It's word of mouth, a friend of a friend, or someone who's been successful. I think I'm very inquisitive and very nosy, so the main part of my consultation is interrogation and asking many, many questions from both partners. I'm very holistic. I want to know all about their general health. And I try to help the patient, if there's time, and if the patient has a lot of eggs and a lot of time, to actually accommodate as many sort of slight adjustments to what's going on with them rather than dive straight into IVF. And I'm pleasantly surprised at the number of patients who actually get pregnant before they get round to doing IVF, which is always the best possible outcome.